Hello, everyone. Welcome and thank you for joining us today. My name is Simone and I'm Community Manager with the OED Marketing team, and I'll be hosting the session. I'm delighted to be here with Dr. Danica Salazar and Mr. Richard Karl Deang, who will be talking to us about how major health crises affect communication. And now, without further ado, I'll hand it over to Danica so she can properly introduce herself and begin. So, Danica, it's over to you.
Thank you, Simone, and thank you everyone for joining us this afternoon. My name is Danica Salazar, and I am World English Editor for the Oxford English Dictionary. That means I am involved in editing and researching entries for the dictionary, particularly those that belong to world varieties of English. Now, in 2020, I guess you all know that COVID-19 dominated global discourse in a way which is rarely seen and which has had a very noticeable impact on language. Now, there have been several articles and think pieces on the new words and phrases that entered the lexicon of the English language because of the pandemic. And the Oxford English Dictionary itself responded to this unprecedented lexical change by quickly adding this new vocabulary in various special updates. And instead of choosing a single word of the year in 2020, releasing an expansive report on the words that define the year with an entire section dedicated to the language of COVID-19. All this is discussed in detail in several OED blog posts and webinars and are all freely accessible on the OED's public pages. Now, in this particular webinar, however, what we would like to do is to look beyond English to see how other languages have responded to the coronavirus pandemic. All of the world's languages had to adapt to a sudden influx of neologisms and scientific terminology as scientists and policymakers strove to convey essential advice to the public in a timely and effective manner. And as the coronavirus spread to ever more densely populated and linguistically diverse countries, it became even more urgent to provide crucial information in various languages so that people who speak these languages are able to fully and easily understand everything they needed to know about this global health crisis. Now, I would like to begin this discussion by talking about the work we've done, the work that was done by lexicographers such as myself, as well as language technologists in Oxford Languages in tracking, researching, defining, and translating the words of COVID-19. And then in the second part of the webinar, my co-presenter Richard will give us some insights from his work in the field of medical anthropology. Now, much of what I will be talking about here comes from work carried out as part of the Oxford Languages Multilingual COVID-19 project, which offers translations of key COVID-19 terminology from English into 19 major languages spoken across the globe. The translations can be downloaded from the Oxford Languages COVID-19 Language Hub, which also provides easy access to insights and analysis on the impact of the coronavirus on the English lexicon, including the latest OED updates I have just mentioned, educational resources to facilitate and support distance learning, information and accessing OUP's world-leading dictionary content remotely, and more. And you can find the link to this resource on this slide. Now, the Multilingual COVID-19 project brings together the expertise of Oxford University Press lexicographers and translators in Oxford, or those who are based in Oxford, and also in its international offices in China, India, East Africa, and South Africa, to offer translations of key COVID-19 terminology from English into 19 different languages: Afrikaans, Arabic, Catalan, Chinese, Dutch, Filipino or Tagalog, French, German, Hindi, Italian, Northern Soto, Portuguese, Setswana, Spanish, Swahili, Tamil, Telugu, Xhosa, and Zulu. Now, these languages together are spoken natively by over 40% of the world's population. Some even serve as international or international lingua francas and are spoken as a second language by hundreds of millions more. However, despite being some of the most widely used languages around the globe, most of these languages have much fewer lexical resources available online than are available for English. Oxford Languages are making these translations available in order to support local public information efforts on COVID-19 in various communities around the world, so that critical facts and life-saving guidance can be conveyed clearly and precisely to as many people as possible. The translations may also be of interest to those wishing to study how different languages are evolving as a result of the coronavirus crisis. Now, the 75 words translated were selected on the basis of corpus data and largely comprise scientific terms relating to COVID-19 from the fields of medicine, biology, and epidemiology. Some of the translated words, such as immune, infection, symptom, vaccine, and virus, already form part of the basic vocabulary of these languages. Others, like droplet, swab, and testing, are common words with medical senses that gained special significance during the pandemic. And still others are highly technical terms that barely a few months ago were familiar only to doctors and scientists. Several of these scientific terms, such as basic reproduction number, case fatality rate, community transmission, herd immunity, morbidity rate, and mortality rate, refer to complex epidemiological concepts that are now being mentioned in news broadcasts and political speeches, as they are the basis of many government decisions with untold impact on millions of lives and livelihoods. Okay, so just giving you here some examples of translations. So starting with the word for the pathogen at the root of this health crisis, coronavirus, which is similar across all 19 languages. All languages make reference to the resemblance of the virus to the solar corona, caused by the characteristic club-shaped spikes protruding from its surface. And most of the languages use some form of the Latin derived word corona combined with the corresponding word for virus. So it's really just coronavirus in the Germanic and Romance languages, and you have their versions, similar sounding versions in Arabic, in Hindi, in Northern Sotho, in Setswana, in Swahili, and in Tamil, Telugu, and Xhosa, in Zulu. Now, Filipino borrowed the English word coronavirus, while the Chinese term literally translates to crown virus. And now, as for COVID-19, the disease caused by the coronavirus, it is also uniformly named in the 19 languages. All have adopted the name given to it by the scientific community, an acronym for the English phrase coronavirus disease 2019. So most languages borrow it as it is. So it's still COVID-19 in the Germanic and Romance languages, or they come in phonetically or syntactically adapted forms in languages such as Tamil and Zulu, or via direct translation of the full phrase, as what happened in the Chinese translation. Right. The COVID-19 translation project also includes words and phrases referring to government and individual actions aimed at containing the spread of the virus and mitigating its social and economic effects. As personal hygiene and the prevention of infection became the main preoccupation of society, words such as disinfectant, face mask, hand sanitizer, and flattening the curve have dominated the conversation in most languages. And as the avoidance of possibly dangerous physical contact became the order of the day, phrases such as flattening the curve and social distancing, previously unknown to people other than statisticians and epidemiologists, have become part of the daily vocabulary of many languages, as when we show some examples of these translations on the table here. Then the English word lockdown, referring to the set of measures the many countries have taken to contain the spread of the virus by severely limiting the movement of people outside the home, has been borrowed by languages like Dutch, Filipino, German, Italian, Telugu, while languages such as Catalan, French, Portuguese, and Spanish prefer their equivalent forms for confinement, while Arabic, Chinese, and Zulu use corresponding expressions conveying some form of closure. So another much used word, quarantine, of Italian origin, has also given rise to self-quarantine, highlighting the self-imposed voluntary nature of this means of avoiding the spread of infection. French speakers have modified quarantine to quatorzaine, replacing the quarante, referring to the 40 days that quarantine periods usually lasted, with quatorze, referring to the 14 days of isolation required of everyone traveling to or later from France. And that's a typical length of confinement advised for people who have or are suspected to have COVID-19. Another trend that we've noticed in coronavirus talk is initialisms. So things like ICU for intensive care unit and PPE for personal protective equipment, which have found equivalent abbreviations in other languages, as we show on this slide. Now, those who are familiar with the history of the English language would know that a few centuries ago, with other health crises such as that we're experiencing right now, English had to borrow words from other languages as a response to similar devastating outbreaks of disease. So words that are familiar to us, such as epidemic, plague, and pestilence, are all loan words from French. But today, however, English is the principal language of global scientific communication, and as such, it has become the source of many of the neologisms resulting from the pandemic. Many consider this prevalence of Anglicisms a bit troubling, so that is not the predominance of Anglicisms in COVID-19 communication is not without controversy, because many people, many citizens of countries such as, say, Italy and Japan, have criticized their leaders for their over-reliance on English loanwords that they feel obscure rather than strengthen their public messages. But still, the influence of English on COVID-19 vocabulary can be seen in some very interesting lexical innovations. So in Italian, for instance, the word droplet has come to refer not only to the very small airborne drops of secretions from the nose, throat, or mouth, or lungs by which the coronavirus can be transmitted, but it also means the distance one person must maintain from another to prevent such a transmission from happening. So we see that there's been a semantic change occurring in because that's not English speakers don't use the word droplet in that sense, but Italians have started to use droplet in this new sense when they speak in it when speaking in Italian. Now, in translating words from English into languages that are entirely different from English and have entirely different linguistic features, we came across certain issues that we needed to address. So one of them is the issue of grammatical gender. So in languages such as Spanish and French, so Romance languages actually, there are languages that make a grammatical distinction between masculine and feminine nouns, and since some of these words are still new, there is still ambiguity in the gender of these words. So one notable example is COVID-19. So although most Spanish and French speakers have begun to use the word as a masculine noun, as they're used to doing with words of foreign origin or other foreign borrowings, their respective language academies have recently decreed them to be feminine, following the logic that words for disease in both Spanish and French, so enfermedad and maladie respectively, are feminine nouns. Although it looks like in the case of Spanish, the Real Academia has relaxed its rules a little bit, and as you can see, the Spanish people who can read the Spanish on this slide will see that they have relaxed a little bit and they're now considering both options to be valid. Now, and then in some languages like Filipino, Tamil, and Telugu, it has also happened that the specific terminology for more specialized words or scientific words have not yet been established. So instead of giving simple translations, we found it necessary to give something more akin to a gloss explaining in the language these concepts. So on this slide, I have some examples from Filipino. So I think when being used in the news or in other sorts of public messaging, Filipinos just borrow the terminology in English, but instead of just leaving that there, we've also provided some sort of gloss in Tagalog just to give the users of this list a better idea of to give them a scientific explanation of the meaning behind these concepts. And also in some languages, actually in all of the languages, translation was not always a one-to-one equivalence. In many cases, there could be multiple variants of the same word. So for instance, I did the translations for the Filipino terminology, and there were some words where I faced with various possibilities. So the word disinfectant, we use in Filipino, we use the word disinfectant in English, but we can also say disinfectante, which is a Tagalogized or Filipinized version of the kind of Hispanic word. Or we can also have like a translation into Tagalog. So you can say pamatay ng mikrobyo or pamuksa ng mikrobyo, meaning something that kills microbes. So all of these possibilities are also included in the translation list, because but all of these possibilities are understandable to speakers of Filipino. So the same happens with the adjective immune, which can be translated just using the English borrowing or using the Tagalog equivalent. Or for instance, self-isolate. So self-isolate has been borrowed into Tagalog, but there's still some ambiguity when it comes to spelling, because you have that entire English phrase that has to be somehow accommodated into the grammatical system of Tagalog. So you have all of these infixes and prefixes, and actually in this case just prefixes being attached to the word into the English borrowing, but you can also have the option of translating using more purely Tagalog form. So in the cases where these options are possible, we also list both possibilities among the translations. So in summary, we can say that we have found two general lexical trends among the different languages when it comes to the vocabulary of COVID-19. So with the exception of the word COVID-19 itself, most of the key terms that we found during the pandemic are not really new inventions, but are words that have been used for years in a different context or within highly specialized scientific discourse, which very quickly entered mainstream usage because of the pandemic. So, for instance, coronavirus, pandemic, quarantine, lockdown, self-isolate, social distancing, R number. So those words have existed in other contexts for a while, but they just came into the forefront because of the pandemic. And we also noticed that although there are general lexical trends that are observed in each language, or in all of the languages, so all of us are talking about locking down, all of us are talking about the coronavirus, all of us are talking about self-isolation. There are also individual ways in which linguistic communities respond to the crisis, and these responses are still shaped by their distinct social and cultural environments. And Richard will be talking about this in more detail in his part. And there are also many takeaways, because in everything that I've discussed, I've only described the words. But what are the insights that we can take away from these words that we have identified? So one thing that we can see very clearly is that the war metaphor is very strong from the very beginning, when we started talking about uh, fighting the coronavirus. So, for instance, we talk about healthcare workers and essential workers being on the front line in the fight for the disease. So that's why in languages such as Filipino or even Indonesian, frontliner actually became a new word that's being used to refer to healthcare and essential workers. But many linguists have also highlighted the fact that it can be quite harmful using the war metaphor when talking about a disease, because and likening healthcare workers to soldiers is not really very good. It's like a false equivalence, because doctors are not really expected to die in the exercise of their duty. And so by calling them frontliners, by fitting them into the metaphor, the symbolism of a soldier, gives them the recognition that they deserve for their bravery and dedication. But as well, it gives us this idea that their deaths are somehow an acceptable part of fighting this crisis, when in fact it is not, because we are not in a war, we are in a medical event. This is a medical crisis and not a violent conflict between nations. So there's something that we can do to prevent the deaths. And then another thing that kind of got our attention is the use of the word wet market. So the OED actually added this word in March 2016 as a Southeast Asian term referring to the sale of fresh meat, fish, and produce. Uh, and if you look at the quotations from the OED, it's actually quite a neutral term. So just talking about the kind of place where you can get fresh produce from in Southeast Asia. And it's not a very frequent word usually, because it's only used by Southeast Asians. And we can see from our corpus data from 2019 that is actually, if you see the frequency per million tokens in the corpus in December 2019, there's really not much usage of the word in relative terms. But starting from January 2020, you suddenly see a spike of usage of the word of the use of wet market. And that is because that's when people started discussing coronavirus and the possible origin of the virus from the illegal wildlife markets in China. And you can see a the sudden peak in the usage of wet markets in March 2020, the when the crisis actually reached its peak. And now, several months later, we can see that even in other languages, you can see from the tweets here on the screen, in languages such as Italian and French, the use of wet market has now left the semantic field of disease, and is now being used metaphorically in other languages as kind of a like an origin of anything that is evil or undesirable, which this as well has been criticized by, especially by people in Southeast Asia, because being from the Philippines myself, I know that wet market is a place where we buy our food. So this conflation of wet markets with illegal wildlife markets in China is actually inaccurate, and to have it spread like this in other languages really perpetuates certain stereotypes of Asian people that a lot of people have problems with, because some people even call for the closure of wet markets, when we really can't do that, because not all wet markets are illegal, not all wet markets are unclean, and in fact, they are a key component of the food supply chain in Southeast Asia. So this is really something that we have to be careful with. And finally, we have the idea of going back to initialism, so we have the concept of LSIs, or locally stranded individuals in the Philippines. And locally stranded individuals are those people who got stuck in Manila and couldn't go, lost their jobs in Manila, but couldn't go back to their home provinces because of closures of transport between Manila and other places. And a lot of them really were suffered a lot while they were stuck in basically what you could consider evacuation centers or public transport centers, waiting to be able to go home, and they're called by the acronym LSI, or locally stranded individuals. So we know that for communication purposes, it's really important to be able to have a name for people who are experiencing this condition. But at the same time, there's a certain level of dehumanization when you're just throwing around words such as LSI. And although this is it's useful to have kind of shorthand when talking about this in the news, there's also this level of kind of forgetting that behind the three letters of LSI are people who are suffering and need our help. So this is um, there is that problem of striking the balance between being effective communicators and also being aware of the humanity behind the health crisis. And also, it is important to note that language and translation are key components of the COVID-19 response. It is clear that there is an urgent need to translate essential information on the pandemic to as many languages as possible in a way that is accurate, accessible, and culturally appropriate. And it is quite good to see that there have been several grassroots efforts among the world's linguists and translators to provide translations of key terminology and health advice in order to fill the gaps for less represented languages and to rely less on lingua francas. So I would now like to hand over to Richard for the second part of the webinar.
Thank you very much, Danica.
So thanks so much, Danica and Simone, and thanks to everyone who's here with us. It's a great pleasure. My name is Richard Deang, and I'm a PhD candidate in anthropology and a graduate student fellow at the Global Infectious Diseases Institute at the University of Virginia. For my part of the webinar, I'd like to relate some of Danica's points about what one might call the excess baggage of words in health communication to my own insights from my research on the use of friendship as a public health approach in HIV/AIDS community programs in Manila and San Francisco in the time of COVID-19. In my presentation, I'll draw on approaches from the sociocultural, linguistic, and medical subfields of anthropology to talk about some of the intersections of language, communication, medicine, and care. After introducing the key concept of indexicality in linguistic anthropology, I'll outline some approaches from medical anthropology, and I'll use the said approaches in my discussion of some of the lessons in health communication that we've learned from our experiences with the only other current global pandemic, which is HIV/AIDS. I'll then conclude by illustrating how we might use these lessons to ensure more effective health communication as we continue to deal with COVID-19 and face the prospect of future pandemics. One of the most useful features of the Oxford English Dictionary for researchers is the dictionary's documentation of examples of how words are used in various moments of history. In my presentation, I'll talk about some examples from the OED and relate them to the historical notes provided in the entries for AIDS, COVID-19, social distancing, and other related terms. Let's consider the entry for COVID-19, for example. In addition to the biomedical definition of the term, which we find here right in the middle, we also have this historical information in smaller font, which gives information about the history of COVID-19, including its original identification in China in December 2019, and the name for the virus that causes it, which is severe acute respiratory syndrome coronavirus 2, or SARS-CoV-2. Now, it might be confusing for some, including me, that COVID-19 is related to SARS in this definition. because the term SARS is more commonly used to refer to another pandemic, or epidemic rather, that also began in China in 2002, as noted in this OED entry. A New Yorker article, we see here an example from 2011 from the New Yorker, reporting that SARS spread from southern China to 28 countries and killed nearly 800 people. Now, although SARS-CoV-2 is the official name of the pathogen that causes COVID-19, following naming conventions, the World Health Organization explains on its website that from a risk communications perspective, using the name SARS can create unnecessary fear for some populations. The term may also make certain populations that were not primarily affected by SARS complacent about COVID-19. The World Health Organization has therefore begun referring to the virus as the virus responsible for COVID-19 or the COVID-19 virus when communicating with the public. The term SARS not only brings another epidemic to mind, but for certain groups, it also evokes a particular negative sentiment and perpetuates certain negative stereotypes about people from China. This referential quality of the term SARS is an example of what linguistic anthropologists call indexicality, a key concept in the semiotic theory of Charles Sanders Peirce. Indexicality is the phenomenon of a sign pointing to or indexing some object in the context in which it occurs. So we can think of various types of indexical relationships, such as pronouns and their reference, pronunciation and geographic origin or provenance, or what we usually call accents, social register and social class, or words and social relationships or ideologies that they're thought to represent or symbolize. We can take, for example, the phrase "Me Too" with the hashtag, which was originally used in social media as early as the early 2000s, and which has since become the battle cry of a global movement against sexual harassment. Now I'd like to relate the indexical aspects of language as social action to approaches from medical anthropology. These two questions are from the syllabus for the introductory undergraduate course on medical anthropology from my university. How do social, cultural, political, and economic factors impact the body? And how do these factors shape the ways people understand, experience, and respond to states of health and disease? Major trends in the subfield include critiques of the Western distinctions between rationality and belief, an approach to healthcare based on understandings of cultural differences, or what we call cultural competency, analyses of the impacts of political and socioeconomic inequalities on people's health outcomes, or what is usually called political economy, and questions concerning the role of our social relationships in determining the ethical meanings that we attach to life, wellness, illness, and death. The history of HIV/AIDS demonstrates how knowledge systems and practices, cultural differences, social inequalities, and moral understandings all impact people's understandings, experiences, and responses to epidemic outbreaks. In 1982, HIV/AIDS was first named gay-related immune deficiency, for example. It was also commonly called the gay cancer in the press. The 1980s outbreak provided an opportunity for a public backlash against homosexuality following the gay liberation movement in the 1970s. We can see examples here from various periodicals from Chile, the UK, France, and the United States, with terms like gay cancer appearing together with words like murió or died, sang in French or blood, and plague. These terms were, of course, exceedingly inaccurate. The OED entry for AIDS provides the following historical note. Although AIDS was initially identified as a disease affecting homosexual men in the United States, it very soon became clear that it was already widely distributed throughout the world. Amid the ubiquity of terms like gay cancer, the earliest examples published or included in the entry were published in the 1980s, early 1980s and included biomedical definitions of the term. We can see acquired immune deficiency syndrome, or AIDS, produces a suppression of the body's natural defenses. From 1982, we have an example from the CDC explaining what AIDS is all about. But by 1983, however, we start seeing examples focused on people and their identities, such as people at risk from AIDS, male homosexuals, drug abusers, and Haitians, a young man called Nick who has AIDS, and others. Finally, in 2009, we can see a shift from people to practices in the example from this local periodical, which reads, "Nuns counsel patients to use condoms against the scourge of AIDS." The example reflects an important shift from an identity-based approach in HIV/AIDS epidemiology and intervention to one based on sexual behaviors. Now, one of the terms that emerged from this shift and that has really persisted since then is the term MSM, which is an acronym that stands for Men Who Have Sex with Men. Since the 1990s, MSM has replaced gay as the demographic category preferred by various HIV/AIDS programs around the world. The examples given by the OED entry for MSM illustrate the epidemiological motivations for this. MSM was specifically conceived in consideration of certain populations, such as Black men who have sex with men, or MSM, from the 1990 example. MSM was meant to signal that HIV/AIDS, was not a gay disease, as mentioned in the 1993 example, but an important issue for people who may or may not self-identify as gay. Considering that MSM is supposed to shift our attention from identity to behavior, the example from 2001 illustrates an interesting use of MSM to refer to a person. "Oh, I don't think he was gay, just another MSM." Finally, the example from 2012 records that MSM had become the preferred term in medical literature. As I mentioned earlier, MSM reflected a shift in HIV/AIDS health communication from an identity-based model to one based on behaviors. It was favored because it was thought that the term did not assume alignments among identity, behavior, and desire, as certain feminist and queer theorists would argue. Other scholars additionally argued that MSM was a key strategy in de-gaying HIV/AIDS to appeal to funding bodies. Just like any other term that seeks a degree of universality, though, MSM runs the risk of erasing the historical significance of the gay community in the fight against HIV/AIDS. Following the HIV/AIDS outbreak in the 1980s, gay and bisexual men, together with their allies, assembled networks of care for each other in the absence of such care from conventional channels. By doing so, they challenged more established methods of healthcare delivery that disadvantaged them due to homophobia and other social prejudices. I explore these social networks of care in my research with community health organizations for HIV/AIDS in Manila and San Francisco, and I show pictures of my friends and interlocutors here. In my research, I ask how various HIV/AIDS communities have used friendship since the 1980s in their responses to the epidemic. I pay special attention to the role of language, not only in building friendships and other social relationships, but also in the joint projects of communities. How do people make friends, and what are they able to achieve together through their friendship? The current COVID-19 outbreak complicates these questions due to the changes brought by the global pandemic to people's social practices. I'll return to this point later. Meanwhile, back to MSM. Certain stakeholders have argued that MSM and other similar terms not only insufficiently describe variations in sexual behavior, but they also undermine the self-labeling of lesbian, gay, and bisexual people and what these terms mean to them. By de-gaying AIDS, MSM has disempowered emergent gay communities and their struggles for human rights around the world. Being gay is more than just about sex. and MSM obscures the historical and social dimensions of being gay. What things do people do together on account of their shared struggles and motivations? I provide the examples of gay and MSM to show how identity categories and other language repertoires are important in building trust and relationships within and between communities. Like HIV/AIDS, COVID-19 has also shown us how health communication can be used to alienate certain populations. Take, for example, this Twitter poll by Fox News host Lou Dobbs, who asked, how would you grade President Trump's leadership in the fight against the Wuhan virus? Superb, great, or very good? Dobbs' use of the term Wuhan virus, following the lead of the former US president, shows how words can be used in health communication to create or reinforce social and political divisions. It's no secret that the COVID-19 pandemic has reinforced anti-Chinese and anti-Asian racism, as Danica pointed out in her part of the presentation earlier. In the United States and other countries, Black communities have been disproportionately affected by COVID-19, while also having to respond to new instances of police brutality. These examples point to an urgent need to include local and indigenous knowledges and grassroots practices in health communication in meaningful ways. In the 1980s, community organizers and members worked with medical professionals, policymakers, and other stakeholders in public health in the fight against HIV/AIDS. Their collaboration was partly based on the recognition of biomedical practitioners that health information may not necessarily be best conveyed in print or textual format. One of the major aspects of community health work for HIV/AIDS has been its focus on in-person, face-to-face interactions with key populations such as gay and bisexual men, sex workers, and drug users in strategic sites such as street corners, cruising spots, and bathhouses. Recent works in linguistic and medical anthropology have similarly explored the role of community activities, such as fiddle stories in Mongolia, in the delivery of information about COVID-19. But how can community-based health program activities be conducted while maintaining social distancing? The question brings us to this OED entry for social distancing, which reveals an older definition based on examples from as early as 1957. The original definition for social distancing is the action or practice of maintaining a degree of remoteness or emotional separation from another person or social group. The definition that is in more popular use right now in public health, or on the other hand, is much younger, and we see examples. And we see examples only as early as 2004. The 2004 article from the Detroit News that is cited in this entry, for example, reads, "The best way to avoid the flu is a wonderful term we call social distancing, which means basically to avoid being around other people." The example provided by the Atlantic Monthly, because of its association with the CDC, is a little more accurate, or not accurate, but detailed. And it provides a clearer illustration of what social distancing might look like. This is long before COVID-19, of course. It says voluntary quarantines, school closings, and even enforcement of mandatory quarantines to keep infected people in their homes. By 2020, the term social distancing no longer comes with a definition in the example from the Tampa Bay, Florida Times, basically signaling how this definition has crystallized and is already in popular usage. The thin line that separates these two definitions points to the main problem with the term social distancing, which is that it is a misnomer. This WHO campaign material explains that keeping each other safe and connected is everyone's responsibility. Physical distancing is not social isolation. I think the most important lesson we've learned from HIV/AIDS is that public health measures should not undermine the importance of social relationships in resolving health crises. Communities emerge from networks of social relationships, and they play an indispensable role in determining health outcomes. An important question that scholars interested in language as social action should be asking right now, therefore, is how, if at all, might digital communication technology such as Zoom help people create or build relationships with each other that help them to achieve common ends, such as the end of pandemic crises like COVID-19. And to end on an optimistic note, I'd like to go back to the OED entry for COVID-19. The first listed example from 2020 reflects how the term was coined following WHO best practices for naming of new human infectious diseases, while past practices tended to link the names of diseases with populations, such as reflected by terms like the Spanish flu and the gay cancer for HIV/AIDS. The term COVID-19 was meant to provide an accessible term for people around the world to use while avoiding the stigmatizing association of the disease with any particular group of people. The challenge now is to balance this neutrality with health communication approaches that remain grounded in the lived experiences and specific needs of key demographics, such as people who are poor, old, or belong to racial and ethnic minority groups. So thank you very much for your attention. And Danica and I look forward to responding to your questions.
Thank you very much, Richard. And we do have some time for questions now. And I do have a couple of questions that have already come in. The first one is, for the multilingual translation project, is this something that is being or will be added on to an ongoing basis?
Well, so far, I think I'm going to answer that question. So far, we have kept the work on this project in-house, and we haven't updated it with any new terms or any new languages since the website first went live. But we are certainly happy to hear from people who have expertise and would like some more information on the project and our future plans for it.
Thanks, Danica. The other question is actually very much related to that. It says, is there a place we can contribute suggestions of words and translations that can be included?
Not at the moment, but as I said, if that is something that people are interested in, I'd be happy to hear from them. And if we see that there is significant public interest in being able to contribute to the project, either with new translations, any corrections to the translations that we currently have, or suggestions for new words to be translated or other languages to be included. So just please to contact us, and if you see that there is a large public interest, then maybe we can see how to take the project forward in the future.
Thanks. The next one I've got here is actually a comment, but maybe you would like to add something to it. It says, it would be fascinating to explore further the development in language around sexuality over time.
Well, yes, that's a very good point. And I think, as Richard has demonstrated, the OED is a good resource for doing that. I don't know if there's anything you would like to comment on that, Richard.
Yes, I absolutely agree, and it's a massive and vibrant field of study, interdisciplinary study in linguistics, anthropology, and other fields. I don't know if the person who asked the question has a more specific question, but I do agree with what they said.
Thanks, Richard. Now, another question I've got here is, does the translation of COVID-19 vocabulary help to improve the COVID situation? Interesting point.
Yes, we believe so, because as I mentioned in my talk, a lot of the communication for COVID-19 has used English, or if not English, just the 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 I think the major languages of the world that are used as regional lingua francas. But as Richard has also mentioned in his part of the talk, it's quite essential to be able to communicate essential healthcare information in a language that people understand and respond to. And it's not always English. It's not always the huge lingua francas with millions of speakers. And being able to provide as many translations of as many words to as many languages as possible ensures that we are reaching as many people as possible, which is really, really essential when combating something like a global outbreak of disease. So I don't know if Richard has any further comments on this.
Yeah, I just want to agree with you and say that although it might take a separate study to find out if how effective these translations are, I think there's reason to believe that having widening the reach of health communication by translating from English to other languages would help communities better understand how the epidemic is transpiring in their own context. So
And also another thing I'd like to highlight is that translation doesn't also simply mean just translating from one language to another. There's also because sometimes people do understand the messages in that language, but there's something about the community's attitude towards the language that also affects the way they react to health advice. Because after all, what you're trying to communicate to people is a change in lifestyle. You're telling them to wash their hands. You're telling them to isolate from their loved ones, which is not an easy thing to ask people to do. And sometimes people find messages more trustworthy in certain languages than others. So these relationships between a colonial language and your own community language, that's really very important. And also the person who communicates this language, these messages to you, is also important. So when I mentioned those grassroots efforts by linguists to provide COVID-19 translations, it's not only to provide them with actual word-for-word translations. So some linguists are also studying in what format these communications should be made. So there's some translators who are actually prioritizing putting messages on YouTube, recording videos of village elders giving healthcare advice in local languages, because this is the kind of communication that elicits more trust from people, and there is more effective in pushing them to make the lifestyle changes that are needed to combat the coronavirus. And especially now that we have now begun asking people to get vaccinated, so we're asking people to stick a needle into their bodies, and that's also another big ask, and that's something that also needs a lot of trust. And language plays a very important role in that.
right, if I can just add, Danica is right that translation is just one step, right, in a process of delivering information to communities. And that's another thing that we learned from our experiences with HIV/AIDS, is that to get information to people, you might have to um, be creative in thinking about how communities talk to each other and learn from each other. So in HIV/AIDS intervention, one of the, as I said earlier in my presentation, one of the most important parts of the community intervention is going to the field and actually going to those sites where people are experiencing those risks, such as street corners or bathhouses, and relying on peer educators, meaning people from the community itself, to talk to community members about risk, about prevention methods, etc. And the challenge, I guess, for COVID-19 is that how are you able to do that while enforcing social distancing, or physical distancing rather? How can you be with communities by way of Zoom, perhaps, or other virtual technologies? So.
Thank you. I've got someone else with their hands up. So Alejandra Karamanian, I have unmuted you, and you can unmute yourself.
Okay, thank you so much. Well, thank you, Danica and Richard, for this fantastic presentation. And this is a question for Danica and your research. project. And I would like to know why Spanish is not included in the translating languages. Maybe because it's the second most spoken language in the world. So you are focusing just in minor languages, just in inverted commas, because French and German, you know, are included in the list of the 19 languages. But why not Spanish?
Spanish is actually included. I
It
don't know.
is included. So sorry,
Yeah.
yeah, it's included.
Yes.
Okay, good. Because I didn't see Spanish. I heard your explanation about why el COVID and la COVID, yeah, which is a big also discussion here in our translation community. And well, that was my question. And 19 languages because in honor of the COVID-19, or just it
No,
was
it was
just by chance.
no, it was just a coincidence. I don't know how that
It
happened,
was
but
a coincidence. Wow.
it just
Good
shows the language.
coincidence.
I'm pretty sure the Spanish is included because I was involved in the translation. So
Yeah, good.
I translated them, so I know that it happened. Unless I dreamed all of that, I dreamt all of that work that I did. So it is there, but we chose the languages because on the basis of, first of all, we want to have a large coverage, so we want to have languages that rep- from different from a large geographical area. So we have languages from Africa, from Asia, and from Europe, um, and in America. But at the same time, we wanted to make sure that the translations are as accurate as possible. So
Yes.
we chose the languages on the basis of whether we have translators in house who are able to do the translation. So, as you know, Oxford Languages is a department of Oxford University Press, which has offices all over the world, and we actually relied on help from our colleagues in UP offices in China, in South Africa, in East Africa, to help us with the translations. And so because we wanted to make sure that we didn't want to do all of the work from Oxford and impose, translations from our perspective. We want to have that native speaker based in those in the populations that speak those languages, making that translation. So I am particularly proud of the fact that we were able to work together in during a very and another thing that's really remarkable about everything that's being done is that linguists are doing these work together during a matter of months. There was this
Yeah.
outbreak and people in a matter by I think by March, linguists were already saying, we need to have these words translated, and by April or May, June, you already had all these different efforts coming out and different translations being made available. And the translation for Oxford Languages is just one of these many efforts in providing translations of this terminology. So we're really glad to be able to contribute to that work.
Okay, thank you.
Thank you.
Thank you. The next question I've got here is there a historical perspective in the multilingual translation project? It might be interesting to see the relevant influence of lingua franca in previous health crises.
Yeah, that would be very interesting, but also would require a lot of work. But I think I think one thing is pretty clear, that as the years go on, we'll be seeing a lot of research coming up about every aspect of this pandemic, and I think that's just one of the things that linguists will be studying. So how individual languages have been impacted by COVID-19. And when it comes to English, I highly encourage you to read the Word of the Year report by Oxford Languages, where we really go into detail about all the COVID-19 words that came up during 2020 in English. And I think it's only a matter of time before linguists in other countries are come up with their own studies, and we will continue to do our own studies of lexicological studies of the impact of COVID-19. Richard, do you have any comments on I mean, because we've been with COVID for only months, but we've been with AIDS for years. So how are there also historical studies that have been done with AIDS that could possibly happen with COVID-19 as well?
One of the things that comes to mind is how HIV/AIDS has produced a really significant impact on the history of identity categories in English, whereas terms like gay and lesbian were dominant until the 1980s. The HIV/AIDS outbreak made it clear that not all people who have sex, not all men who have sex with men identify as gay, and brought these identity categories into question in terms of how they align sexual behavior with sexual identity and desire, as I pointed in my presentation. So HIV/AIDS was one of the major factors that contributed to the emergence of the term queer, to refer to how these things, identity, behavior, and desire, don't align with each other. So it has impacted English in some ways, and this has been studied by linguists as well.
It's about when you mentioned the metaphor of war related to COVID-19, the person saying that the metaphor is almost literal, and she's wondering if you agree with this.
Yeah, I mean, it really for me, what is I can see why that metaphor has been widely adopted. I think it's a lot of people just want to, especially when it comes to talking to essential workers and healthcare workers as people on the front line or frontliners. I think people are just eager to give these people the recognition that they deserve, because they really are, you know, all ahead of us, like facing this risk head on to save the rest of us, which is a really heroic act that deserves this recognition. But at the same time, even healthcare workers themselves have pointed this out, that if you take that symbolism to an extreme, it can also be harmful, because when you think, because soldiers go into the battlefield with a very high risk of losing their lives, but it should not be the same. It can never be equated. A war can never be equated to a health crisis, because the coronavirus is not an armed combatant. He's not. It's not a person who's there whose sole intent is to kill you. It's a virus. We can. There are certain things that we can do. We could have done from the beginning in order to protect our healthcare workers, so that they don't have to,
Mm-hmm.
to lower the mortality rate. And so that's the thing that's somehow forgotten if you think too much of that, because then people read that and they go like, okay, this is the death toll for healthcare workers, and we kind of think it's like the same as looking at the death toll during a war, but it's not the same. It can never be acceptable. Doctors are not trained to they're trained to be doctors, and not to be killed. And so that's what the point that's what my point was when I talked about that metaphor. So yeah, we just have to be careful when certain because it's an attractive like imagery. But there are certain ideas that come with those analogies and symbolisms that may be more harmful rather than helpful.
Right,
Thanks,
and
Danica.
if I can just add, this is obviously part of a larger discourse linking epidemic outbreaks to war. We can consider the naming of COVID, the virus responsible for COVID-19 as the Wuhan virus, as part of this conflict between the U.S. and China that's been emerging in recent years. And it was actually at an important peak during the COVID-19 outbreak last year, I'm referring to the US-China trade war, of course. And I also wanted to add that this use of war as metaphor for COVID-19 is not new, and that HIV/AIDS also had this war metaphor that predominated health communication and HIV/AIDS intervention discourse. The immune system was thought of as the defense mechanism of the body. For example, HIV/AIDS as a pathogen was thought of as a foreign intruder to the body, which was thought of as the nation state. So in countries like the Philippines, for example, which particularly had really complex relations with the United States during that time in the early 1990s, with the proposed closure of military bases. HIV/AIDS was seen as a foreign intrusion from the United States to the Philippines by way of the women sex workers who entertained American GI soldiers who were stationed in the Philippines back then. So HIV/AIDS was seen as a metaphor for this conflict between the Philippines and the United States. So,
and also, if I might add, that this idea of fighting disease, it's not new. I mean, disease as an enemy and fighting it, it's something. It's part of the conceptual frameworks in a lot of languages. It's one of the basic conceptual metaphors that we have. So we do have it. We do fight disease. We do say to fight disease. And remember the example that I gave earlier, the way that we translated disinfectant into Filipino. One way we did that is to say pamuksa ng mikrobyo, and puksain is the verb in Tagalog of fighting. So a disinfectant is something that literally fights. Literally translated is something that fights a microbe. So I understand why such a metaphor exists, because it's such a basic thing in a lot of languages, but it's also when we take it to an extreme that it can be, worrisome.
So we still have a few minutes. So here goes another question. It's a question for you, Danica. So I'm going to read it for everyone else's benefit, but I've also made it visible to you because it's a bit long. So have you also analyzed cross-linguistic differences in the semantics of verbs for preventive behaviors? For instance, in English, the standard expression is to protect yourself from the virus. In other languages, like Masa, spoken along the border between Cameroon and Chad, the verb escape, run away from the virus, is preferred instead. I wonder if you have observed similar cases in the languages the OED team has worked on so far. You will see that differences in this domain may have profound implications at the level of people being engaged, not just reached by the message.
That is actually a very, very interesting point. And I love those examples from other languages that we didn't, that's not included in the translation project. I don't know if we've looked at these expressions specifically, but it's something that's definitely worth looking at, because as I've mentioned before, every language has its own set of conceptual metaphors that they use when describing disease. And one thing that would be interesting to do is to look at because I did show you in my presentation some generalized trends that we've observed, although this one I have not particularly looked at it. But one thing that would be good to maybe write a blog post about in the future is to talk to the translators and ask them what are the differences that they've specifically found interesting, and where there were instances that they had to stop and think, okay, this is worded differently in English, and I have to kind of think of a way to translate this symbolism in my language. So yeah, I think definitely a good point.
Thank you very much, Danica. We do have a lot more questions, but I'm afraid we are running out of time, so we'll have to wrap up. But the panelists have very kindly agreed to answer the questions that we were not able to address on the live session today. So all these will be passed on to them, and once we prepare the recording to make it available for viewing, we're going to post all the questions that were not addressed today there as well. So I just wanted to say a big thank you to Danica and Richard for very interesting presentations. I hope you enjoyed them as much as I did. So thank you very much, you two, for presenting, and thank you very much, everyone, for attending. So I hope this has been useful and interesting for everyone. So thank you very much, everyone.
Thank you, everyone. Thank you, Simone.
Thank you.
And
Thank you so much, Simone, Danica. It's been a
Thank you.
pleasure.
Thank
And
you.
bye, everyone.
Have a good evening. Bye.